Hello, my name is Dina Parker Mathis, and I'd like to welcome you to this training on seizure disorders, how to properly care for someone who is having a seizure. I would first like to give a working definition of what is a seizure. A seizure is a sudden change in the brain's normal electrical activity. During a seizure, brain cells fire uncontrollably at up to 4 times their normal rate. This temporarily affects the way a person behaves, moves, thinks, or feels. There are many conditions that may trigger a seizure. They include, but are not limited to, brain injury, either before or after birth, metabolic problems, high fever, especially in children, genetic conditions, including tuberous sclerosis, eating and drinking toxic substances, infections, especially meningitis and encephalitis, as well structural abnormalities in the brain's blood vessels. There are 2 major types of seizures. Primary generalized seizures affect the entire cerebral cortex, the outer portion of the brain, which mostly contains brain cells. The abnormal firing of brain cells occurs on both sides of the brain at about the same time. Now, partial or focal seizures are the abnormal firing of brain cells beginning in one region of the brain and remaining in that one region. We will discuss 3 types of primary generalized seizures. The first, generalized tonic-clonic seizures, commonly known as grand mal seizures or convulsions. Usually the person falls to the ground and loses consciousness. Body muscles contract and tighten, loss of bowel or bladder control in some cases. Usually the grand mal seizure lasts less than 1 minute, followed by lethargy and temporary confusion. Safety is first and foremost if you are near a person having a grand mal seizure. First, you should help the person lie down and turn onto one side. Place something soft under the person's head. Loosen any tight clothing, including ties, necklaces, or blouses. Do not restrain the person's arms or legs. Do not put anything in the person's mouth, including your fingers, as you may become injured. There was a time when people were instructed to put a tongue blade into the mouth to prevent the person from swallowing their tongue. That is not recommended. Absence seizure, commonly called petit mal seizure, presents as a brief loss of consciousness, so brief that the person does not change positions. Rather, they may have a blank stare or rapid blinking for a few seconds. Petit mal seizures typically begin in childhood or early adolescence. The third type, status epilepticus, is a life-threatening medical emergency. This is a prolonged seizure that can last 20 minutes or longer. The person can experience a series of seizures without fully regaining consciousness. Again, status epilepticus seizures are considered a life-threatening medical emergency. The second major type of seizures, partial or focal seizures, has 2 categories. The first, simple partial seizure, a person experiences feelings, sensations, movements, or other symptoms. The person does not lose consciousness and remains awake and aware. The symptoms may vary depending on which part of the brain is affected. They may experience jerking movements in part of the body, experience abnormal smells or a distorted environment, unexplained fear or rage. The person may have what they call an aura, where they may smell flowers. They may see spots or dots. This is usually the preface to a seizure. The next would be complex partial seizure. This is the most common type of partial seizure. The person loses awareness of their surroundings. The person is unresponsive or partially unresponsive. The person may have a blank stare, chewing or lip smacking, or repetitive movements of their hands. This person is typically confused or has no memory of the episode. If you are near a person having a complex partial seizure, you should stay with the person to provide comfort, talk calmly and directly, protect the person from any self-injury, remove any furniture or other objects that have the potential to cause injury. After the seizure, explain to the person where they are and what has taken place. Do not, again, do not restrain or try to restrain the person, as you could cause injury to the individual as well as yourself. You should call 911 when any of these occur. If a seizure lasts more than a few minutes, if a person does not completely return to his or her normal state after the seizure, and the post-seizure period, which usually lasts less than 30 to 60 minutes. If the person is not able to effectively communicate with you as they did prior to the seizure, or cannot eat, drink, or return to their normal state, please call 911. Thank you for participating in this training on seizure disorders, how to properly care for someone who is having a seizure. Have a wonderful day.